Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are going to kickstart a new series of 50 lectures of prime neurology. So I'm sure that if one listens to these 50 episodes of primary neurology, they would have acquired a good knowledge of neurology. So we are starting a series of 50 lectures of prime neurology. So this is the first episode, primary neurology part 1. As the name suggests, it is the most important neurology. Prime neurology part 1, introduction and overview of the nervous system. The major anatomical components of the nervous system. The nervous system consists of central nervous system and peripheral nervous system. The CNS is made up of brain, encephalon, which lies rostral to the foramen magnum, and the spinal cord myelin, which lies caudal. So here if you see the diagrammatic representation, this is the anterior part which controls the behavior and the motor system, and then we have the posterior part which is responsible for sensation and perception. So the cerebellum is present here, and it is primarily responsible for coordination and balance. And then we have the brainstem, midbrain, pons and medulla oblongata. We have the heart and the circulation gastrointestinal tract, the autonomic system, and then the sensory receptors which ascend through the sensory tracts, namely spinothalamic tract or posterior column, and go to the brain. And then we have the autonomic bladder and reproductive organs in the sacral part of the spinal cord. From the anterior horn cells of the spinal cord, we have the nerves coming up, making up the neuromuscular junction, and finally the muscle. So we have the encephalon, brain, cerebellum, brainstem, spinal cord and muscle. These are the major anatomical components of the nervous system. Anatomy of the cerebral cortex. The brain is made up of cerebrum, diencephalon, brainstem and cerebellum. The cerebrum, telencephalon, is the largest component of the CNS. It consists of two cerebral hemispheres connected by the corpus callosum. The diencephalon, that means between the brain, lies between the telencephalon and the midbrain. Anatomy of the cerebral cortex. So basically we have four lobes: frontal lobe, the temporal lobe, the parietal lobe and the occipital lobe. So this is the lateral part and this is the medial part. So lateral part, we have the central sulcus. So this is the central sulcus. We have the precentral cortex or the primary motor cortex, and then postcentral we have the primary sensory cortex. So we have the central sulcus, anterior to it is the precentral gyrus and the primary motor cortex. Posterior to the central sulcus is the postcentral gyrus and the primary sensory cortex. And then we have the supramarginal gyrus and the angular gyrus. When we come to the motor cortex, primary motor cortex, we have the face area here, but as it goes laterally and then it goes to the medial part where we have the foot area and the supplementary motor area on the medial part. In the lateral part of the cortex, there are few important areas. The first is the frontal eye fields, area number 8, which is responsible for the movement of the eyes to the opposite side, what we call it as the saccadic eye movements. So we have the frontal eye fields area number 8 here, that is key area number 1, and 2 is the Broca's area. So this is the Broca's area, this is the inferior frontal gyrus. This is primarily responsible for the word output or the fluency of the speech. And 3, we have the primary visual cortex, primary vestibular cortex. It is responsible for balance. And 4, we have the primary auditory cortex. The auditory cortex is responsible for comprehension of the speech. And 5, Wernicke's area. So Wernicke's area is this area, and this is the Broca's area. So these are the 2 important areas of the language. The Broca's area is for word output, and the Wernicke's area is for the understanding or comprehension of the speech. So 4th is the primary auditory cortex. This is about the lateral part of the cortex. When we come to the medial part of the cortex, basically the most important structure we see here is the corpus callosum. The corpus callosum is the important structure which bridges or connects the 2 cerebral hemispheres. As I said, the premotor cortex, we have the face area here, but as you ascend, it becomes the leg area and comes to the medial part. So basically in the medial part, we have the leg area and the supplementary motor cortex. And then we have in the occipital cortex is here, we have the primary visual cortex, and then we have the parahippocampal cortex here. One of the oldest components of the cerebral cortex. It is hippocampus plays a very important role in memory, as well as its destruction causes seizure generation. So this is the important, these are the important aspects of the anatomy of the cerebral cortex. So coming to the motor homunculus and the motor system, we just saw the motor cortex, the precentral gyrus. So this is the precentral gyrus, the motor cortex. So the representation is not according to the quantity, it is according to the quality. Though the trunk is very huge here, but the representation in the brain is very, very less. Though our fingers, the area is very less, the representation in the brain is huge. You can see here the entire hand, the fingers are represented in a very big way in the cerebral cortex, especially if you see the thumb. Likewise, face also has got a major representation, face and the tongue here, the lips here. So the representation is according to the usage, the quality. The more we use, the more they are represented. So we keep using our face for various facial expressions. We keep using our fingers for various activities. In fact, the man is placed highest in the hierarchy of the animal kingdom because of 2 reasons. One, the language and intelligence. Second is the manual dexterity. The various ways, the manipulation done by our fingers, no animal on earth can manipulate or use fingers like us, the human beings. So manual dexterity and intelligence language places us highest in the animal kingdom. And because there's a complex manual dexterity which can be accomplished only by human beings, the representation of hand is very much big in the cortex. So this is the arm, trunk, knee, and as I said, the leg areas goes into the medial part of the hemisphere. This is the lateral cortex and this is the medial cortex. This is about, we are talking about the motor homunculus or the motor system. That is, we are talking about the motor cortex, precentral gyrus. But how does the information from the precentral gyrus, namely the hand, the mouth, the foot, go to the spinal cord level and then interact with the muscles? So we have the foot in the medial aspect, we have the hand in the lateral aspect, we have the motor area on the lateral aspect. They all condense. This is the motor cortex. You can see here, this is the motor cortex. They all condense together. This is a corticospinal tract. They all condense together and get denser. At this level, this is known as internal capsule. So they all condense together. So a small lesion here will produce a dense hemiplegia on the opposite side. because corticospinal tract crosses at the level of the medulla oblongata and goes to the opposite side. Whereas a lesion here, like anterior cerebral artery, produces only a selective leg weakness. A lesion here, only the face gets affected, like middle cerebral artery. But a lesion here, like anterior choroidal artery, there's a dense hemiplegia because all the corticospinal tracts get crowded together in the internal capsule. So this is the motor cortex. They descend as pyramidal tract, which is primarily responsible for movements, and at the level of the medulla oblongata they cross over to the opposite side, descend and go to the anterior horn cells of the spinal cord as a lateral corticospinal tract, and then from the anterior horn cells they come as nerves, go to the neuromuscular junctions and supply the muscles. So this is the corticospinal tract, the lateral corticospinal tract, which is mainly concerned with movement. So the corticospinal tract comes from the motor cortex, gets denser, they converge in the internal capsule and go to the motor part of the cranial nerve nuclei, which we called as corticobulbar tract, and some of the fibers descend, cross at the level of the medulla oblongata and go to the anterior horn cells, what we call as lateral corticospinal tract. So this corticobulbar tract going up to the motor part of the cranial nerve nuclei and the other component going up to the anterior horn cells, corticospinal tract, make up the UMN or upper motor neuron. Likewise, we have lower motor neuron from the anterior horn cells, what comes as the nerve neuromuscular junction and muscle, we call it as the lower motor neuron. So lower motor neuron also, there are two components. One is the peripheral nerve and second is what comes from the motor part of the cranial nerve nuclei as cranial nerves. They are also lower motor neuron. So here lies a very important concept for motor system. Motor system is the motor activities are primarily done by corticospinal tract or the upper motor neuron. Upper motor neuron has got two components. One is the corticobulbar tract going up to the motor part of the cranial nerve nuclei or the anterior horn cells known as the corticospinal tract. So upper motor neuron has two components, corticobulbar tract and corticospinal tract. Likewise, what comes from the anterior horn cells or from the motor nuclei of the cranial nerves is known as the lower motor neuron. So lower motor neuron also has two components. One is the peripheral nerve, second is the cranial nerve. So this is the tract which is primarily responsible for movements. But we have two important systems, the basal ganglia. The basal ganglia, the putamen, globus pallidus, which form the basal ganglia, and the cerebellum. These two systems control the motor system and they have a very much great influence in control of posture and balance. So this is the descending control of posture and balance, which is done by basal ganglia and cerebellum. So the motor system, neurons from the motor cortex descend as the pyramidal tract in the internal capsule and cerebral peduncle to the ventral brainstem, where most cross low at the medulla oblongata. This is it. In the spinal cord, the upper motor neurons form the corticospinal tract in the lateral column before synapsing with the lower motor neurons in the anterior horn cells. The activity in the motor cortex is modulated by influences from the basal ganglia and cerebellum. Pathways descending from these structures control posture and balance. B. So this is a very important slide regarding motor homunculus and the motor system. Now we'll talk about the sensory homunculus and the sensory system. Sensory homunculus, it is basically seen in the somatic cortex or postcentral gyrus. So it is also similar to the motor cortex. So again the representation is according to the quality and not according to the quantity. So where the perception of sensation is very important, there's a huge representation. So you can see the representation is highest in the hands and the fingers, on the face and the lips, teeth, but the representation is very less in the trunk and moderate in the leg area. So the representation is highest in the fingers. Therefore, when we do 2-point discrimination where the 2 points are felt separately, the 2-point discrimination is highest in the fingers and the lips, because the representation in the postcentral gyrus of the sensory homunculus is highest for the lips and the fingertips, and there the representation is highest, whereas on the back it is very less. So this is the sensory homunculus: leg, arm, fingers, face, teeth and tongue. So when we see the sensations are perceived by the receptors, they ascend through two important tracks. One, the posterior column, the joint position, vibration and accurate touch are sensed by the posterior column, which ascend from the receptors, go as a dorsal columns, ascend ipsilaterally, go to the gracile and cuneate nuclei, and at the level of the medulla oblongata they cross over to the opposite side, goes to the thalamus and finally to the parietal cortex. So the sensations goes through the thalamus and then finally they reach their destination, parietal cortex. So most of the sensations get affected with a thalamic lesion, but there are some sensations which are perceived by exclusively by the parietal cortex. These are known as the cortical sensations. So most of the sensations are perceived by the thalamus, but some of the sensations are perceived only by the parietal cortex, known as cortical sensations. They are tactile localization, 2-point discrimination, graphesthesia, barognosis and stereognosis. So one important tract which I have just seen is the dorsal column, which carries the sensations of joint position, vibration sense. The other important tract is the lateral spinothalamic tract, which carries pain, temperature and poorly localized touch. So this is the spinothalamic tract. Another very important difference between the spinothalamic tract and posterior column is that the spinothalamic tract takes sensations from the receptors, ascends 1 or 2 segments, but immediately, you can see here, it crosses in the spinal cord. It goes through the gray matter, traverses the gray matter of the spinal cord, goes as lateral spinothalamic tract. So it crosses immediately in the spinal cord, whereas posterior column crosses only at the level of the medulla oblongata to the opposite side, whereas spinothalamic tract ascends 1 or 2 segments and crosses immediately in the spinal cord and goes and ascends and goes to the medulla oblongata. Finally, it also goes to the thalamus and then finally it reaches its destination, parietal cortex. So this is the sensory homunculus and the important concepts of the sensory system. So anatomy of the brainstem. The brainstem connects the diencephalon with the spinal cord. The brainstem consists of the midbrain, pons and medulla oblongata. The cerebellum is a large structure that lies posterior to the brainstem. It is composed of midline vermis and paired lateral hemispheres and is connected to the brainstem by the superior, middle and the inferior cerebellar peduncles. The spinal cord extends from the cervicomedullary junction to the conus medullaris. So this is the anatomy of the brainstem. We have the midbrain and then the pons and then the medulla oblongata. So ventrally you see the descending motor tracts. So the arrow is put down, so it is a descending motor tracts. They go ventrally in the brainstem, and the sensations are carried by the ascending sensory tracts. So here it ascends, takes the sensations from the receptors. So you can see the upgoing arrow. So these are the sensory tracts. So the important structures which are present in the midbrain is the third cranial nerve and the fourth cranial nerve. And then we have a lot of reticular system here. So this is the pyramidal tract, the motor tract. These are sensory tracts. In the pons, we have important cranial nerves 5, 6, 7 and 8. So we have 5, we have 7 here going and encircling the 6th nerve nucleus. We have the 6th nerve nucleus and 7th and then the 8th. When it comes to the medulla oblongata, the important cranial nerves we find are the 9th, 10th cranial nerves, 11th cranial nerves and 12th cranial nerve nucleus. So in midbrain we have 3, 4, pons we have 5, 6, 7, 8 and medulla oblongata 9, 10, 11, 12. And this is the cerebellum. A very important aspect of cerebellum is that it is concerned with balance. So how does it accomplish its activity? It is an important coordinator. It is an important comparator. it compares two important information. One, the intended movement. When we want to perform a movement, the intended movement comes from the frontal cortex, and then it comes to the pons and it goes to the cerebellum. So this is known as frontopontocerebellar tract. So the intended movement comes from the frontal cortex, goes to the pons, and the bundle of pontine fibers goes to cerebellum. So frontopontocerebellar tract conveys the intended movement, what the movement we want to perform. But the actual movement, what the movement has been performed, is carried by the sensory tracts and goes to the cerebellum. So the intended movement comes from the frontal cortex and goes to the pons and the cerebellum, frontopontocerebellar fibers. The actual movement, the sensory tracts carry it to the cerebellum. So now the cerebellum compares the intended movement with the actual movement and makes final adjustments, fine tunes, and sends information about the correct movement which we have to perform from the cerebellum, goes back to the frontal cortex from the dentate nucleus known as dentorubral red nucleus, thalamo and cortex, dentatorubro-thalamo cortex. So the intended movement comes from the frontopontocerebellar tract. The actual movement comes from the sensory tracts of the cerebellum. The cerebellum compares these two movements and adjusts the movement to give the perfect exact movement, and the information goes from the cerebellum back to the cortex to the dentatorubro-thalamo cortical tract. Why cerebellar manifestations are seen on the same side unlike motor or sensory which is seen on the opposite side? Because of the double crossing. One, it comes from the frontopontocerebellar fibers, it crosses to the opposite side, and back again from the cerebellum it again crosses dentatorubro-thalamo cortical tract. Because of the double crossing, the manifestations are seen on the same side. And how to important all these important concepts of the brainstem? It is easy to remember by a rule of 4. Remember a rule of 4. There are 4 cranial nerves in midbrain and above, 4 in the pons and 4 in the medulla oblongata. The 4 cranial nerves in the medulla oblongata are 9, 10, 11 and 12. The 4 cranial nerves in the pons are 5, 6, 7, 8. The 4 cranial nerves in midbrain above are 3, 4 in the midbrain and 1, 2 above the midbrain. So rule of 4, 4 cranial nerves in midbrain and above, 1, 2 above midbrain, 3, 4 in the midbrain, 5, 6, 7, 8 in the pons, 9, 10, 11, 12 in the medulla oblongata. And some of the cranial nerves are placed medially, some of the cranial nerves are placed laterally. The cranial nerves which can divide 12 into equal parts are placed medially. The cranial nerves which cannot divide 12 into equal parts are placed laterally. For example, if we take midbrain, the 3 and 4 cranial nerves can divide 12 into equal parts. 12 by 3 is 4, 12 by 4 is 3. So they are placed medially. When we come to pons 5, 6, 7, 8, only the 6th cranial nerve divides 12 into equal parts. 12 by 6 is 2. But 12 by 5, 12 by 7, 12 by 8 cannot divide 12 into equal parts. So they are placed laterally. But 6th cranial nerve is placed medially because 12 by 6 is 2. Again, when we come to medulla oblongata, we have 9, 10, 11, 12 cranial nerves. Only 12 can divide 12 into equal parts, that is 12 by 12 is 1, so it is placed medially. The other cranial nerves which cannot divide 12 into equal parts like 9, 10, 11 are placed laterally. So this is about cranial nerves. When we come to the motor system, ventrally, the tracts which start with the letter M are placed medially, the tracts which start with the letter S are placed laterally. For example, the tracts which are placed medially are M. One is the motor tract, that is the corticospinal tract. Second is the MLF, medial longitudinal fasciculus, which connects 3rd, 4th, 6th with 8th nerves. The other tract which starts with the letter M and placed medially is the motor part of the cranial nerves, all the motor part of the cranial nerves. And then M is the medial lemniscus, that is the posterior column, which is also placed medially. The tracts which start with the letter S are placed laterally. One is the spinothalamic tract, which carries pain and temperature sensation. The spinocerebellar tract, which is responsible for balance. The sensory part of the cranial nerves, that is the trigeminal nerve, and the sympathetic tract. So sympathetic tract starts with the letter S. Sensory part of the cranial nerves, 5th nerve, starts with the letter S. Spinocerebellar tract starts with the letter S. Spinothalamic tract starts with the letter S. The tracts which start with the letter S are placed laterally. The tracts which start with the letter M are placed medially. Name the motor tract, the corticospinal tract. The medial lemniscus, that is the posterior column. The motor part of the cranial nerves, and the MLF, medial longitudinal fasciculus, which connects 3rd, 4th, 6th with 8th. So if you remember the rule of 4, it is easy to remember the anatomy of the brainstem. Yeah, now we'll talk about the development of the nervous system. The neural tube lies between the ectoderm. So this is the ectoderm on the surface and the notochord below. So the cranial part of the neural tube evolves into the brain and the caudal part becomes spinal cord. Another important concept here is that since it evolves from the ectoderm, generally when there are development anomalies of the brain or spinal cord, we see it on the skin also, because skin and brain both evolve from the ectoderm. Therefore, we have the neurocutaneous markers. In the developmental or congenital abnormalities of the brain, we generally look out for the neurocutaneous markers because skin and brain both develop from the ectoderm, and therefore when there are congenital anomalies of the nervous system, we have to look for the skin for neurocutaneous markers. So this is a very important concept. So this is the development of the nervous system. The neural tube lies between the ectoderm on the surface and the notochord below. The cranial part of the neural tube evolves into the brain and the caudal part evolves into the spinal cord. The neural tube defects are common congenital malformations that result from failure of the normal neural tube closure during embryogenesis. Generally, it should close. If it does not close, we have the neural tube defects. They may be divided into upper type, anencephaly. The upper pore, generally they close around 24-25 days. If they do not close, they develop congenital anomalies. If the upper tube does not close, we develop anencephaly due to failure of closure of the anterior pore, and therefore the brain evaginates out. In the lower type, the spinal dysraphism, there is a failure of closure of the posterior pore, so the spinal cord comes out of the vertebral column. So neural tube defects, there can be upper type anencephalys where the anterior neuropore does not close, so the brain evaginates out, comes out, or the lower type where the posterior neuropore does not close and the spinal cord comes out. Neurophysiology. So this is about the neuroanatomy. Neurophysiology, how is the impulse generated and the transmission of the nervous impulse. Neurophysiology, generation and the transmission of the nervous impulse. The role of the central nervous system is to generate outputs in response to external stimuli and changes in the internal conditions. Each neuron receives input by synaptic transmission from dendrites, which go to produce an action potential that is then conducted along the axon, resulting in synaptic transmission to other neurons or in the motor system to muscle cells. If I show the diagram, it will be better understood. So this is the synapse between the nervous cells. This is the generation and the transmission of the nervous impulse. So A, so this is the action potential. A, this is the action potential. This arrives at the synapse. Once the action potential arrives at the synapse, B, there is influx of calcium ions. Once there is influx of calcium ions, C, there is neurotransmitter is released. The neurotransmitter is released. D, the neurotransmitter activates the postsynaptic receptor. And E, a new action potential is generated. And finally F, there is reuptake. There is reuptake of neurotransmitter molecules. Example, serotonin. If for example, if serotonin, the uptake is inhibited, the serotonin levels increases, and therefore since serotonin is known as a happy hormone and gives happiness, it is used as a antidepressant. SSRI, selective serotonin reuptake inhibitor. So reuptake of neurotransmitters. For example, if we inhibit this particular step, there is reuptake of neurotransmitter. Example, serotonin is inhibited and therefore there's a lot of serotonin, there's a lot of happiness because it's an antidepressant hormone, so an antidepressant. So we selectively use this mechanism in terms of pharmacology and for treatment of patients also. So this is about the synapse between nerve impulse, generation and transmission of the nerve impulse. A is the action potential arrives at the synapse. B is the influx of calcium. C is the neurotransmitter release. D is the neurotransmitter activates the postsynaptic neurotransmitter. E is the action potential, and F is the reuptake of the neurotransmitter molecules. So finally, to conclude, the complexity of the brain differentiates us from other species, and its interactions with the spinal cord and peripheral nerves combined to allow us to perceive and react to the external world while maintaining a stable internal environment. The brain is arguably the most important organ in the human body. It controls and coordinates actions and reactions, allows us to think and feel, and enables us to have memories and feelings, all the things that make us human. I hope you have enjoyed listening to this introductory chapter of Prime Neurology. We have just discussed the first episode of Prime Neurology. There are 49 more episodes, and I'm sure if you listen to all these 50 episodes of Primary Neurology, you would get a good knowledge of neurology. I put all important clinical neurology points, concepts in a book called Exam Oriented Clinical Neurology, written by me, Sreenivas. This book will be very useful for students appearing for clinical neurology exams. So if interested, this book could be purchased. The other important book I've written is Focused Neurology, written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. All important theoretical aspects of neurology, I put it in this book, Focused Neurology, in a question and answer format. This book is available from all leading booksellers, including Amazon. So if interested, this book could be purchased online. This book will be very useful for students appearing for Viva or oral exams. If you have enjoyed listening to these wonderful concepts of the Introduction of Neurology Prime Concepts Episode 1, please like and share and subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel. So kindly subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.